everybody. So, a little introduction about myself. I'm James Parker and I'm Head of Community Services for the Forward Trust. I've worked for the Forward Trust now for over 11 years, which has been a fantastic time for me. We've grown as an organisation in terms of our community services. We were known originally as a prison provider, working in a number of prisons for the last 30 years, delivering recovery-orientated programmes in prisons. And then over the last 8 to 10 years, we've really developed our community profile. And we have services in East Kent, we have services in Medway, services in Southend, services in Thurrock, and also day programme services in Essex, and also services in Liverpool, and also services in Hull. And a lot of them are based around recovery-orientated systems that have a day programme embedded in them that creates a recovery community and a recovery network, all featured around the idea that people can transform their lives, that people can make a big difference, and that we can support them to make big differences. So the relationship we've built up with Breakeven in Southend contract is based on those principles, that actually we can do something that makes a massive difference to people's lives. Forward Trust is a provider of a range of support services across the east of England, operating in both community settings and within the prison system. Our organisation has long been committed to helping individuals facing significant challenges in their lives, particularly those who have been affected by substance misuse, mental health struggles, homelessness and social disadvantage. The services we offer are wide-ranging and include drug and alcohol recovery programmes, reconnect services for individuals leaving custody, and personal wellbeing programmes designed to support people in making positive changes. By working closely with individuals in both structured and flexible ways, we help them regain control, improve their quality of life, and move forward in a more stable and fulfilling direction. Through these services, we reach and support thousands of people every year. While individuals come to us through different entry points, some seeking help with addiction, others needing support for mental health, housing, or reintegration into society, what we often find is that they share many common experiences. Many of those we support have faced significant hardship, including poverty, trauma, family breakdown, and long-term unemployment. These factors often create a cycle of disadvantage that can be difficult to break without tailored, comprehensive support. The reality for many of our service users is that they are not just struggling with one isolated problem, but are dealing with multiple interrelated challenges at the same time. In our work, we frequently see individuals who are experiencing substance misuse issues alongside mental health conditions such as anxiety, depression, or PTSD. Additionally, many are facing housing insecurity, financial difficulties, long-term unemployment, and difficulties navigating the criminal justice system. These overlapping issues can make it even harder for individuals to access the help they need, as traditional services often focus on only one aspect of a person's challenges, rather than taking a holistic, person-centred approach. In this context of complex needs, we began to recognise that gambling-related harm was affecting a significant number of the people we were already supporting. As we work with individuals struggling with substance misuse, mental health challenges, and financial instability, we increasingly noticed that problem gambling was often part of the picture as well. Over time, we became more aware that gambling harm was not only present in our service user population, but was also a growing problem, making it even harder for people to achieve stability and long-term recovery. Understanding that we needed to do more to address gambling harm, we were keen to work with specialist partners who could help us develop a more effective response. While our teams are experienced in supporting individuals with substance misuse and mental health issues, we recognised that gambling harm required specialist knowledge and tailored interventions. We were therefore delighted to establish a partnership with Breakeven, an organisation with deep expertise in supporting individuals affected by gambling problems. Their team has provided invaluable insight, tools and resources that have helped us integrate gambling support into our existing systems. At the same time, we were encouraged to see that local drug and alcohol commissioners were also making the connection between gambling harm and substance misuse. In particular, the commissioning team in Southend recognised the growing link between gambling and addiction, and as a result they incorporated gambling support into their service specification for substance misuse programmes. This was an important step forward in ensuring that individuals accessing substance misuse treatment were also being screened and supported for gambling-related harm. Our partnership with Breakeven has continued to grow over the past few years, and together we have been able to make significant progress in addressing gambling harm within our services. One of the key elements of our collaboration has been integrating gambling harm screening into our substance misuse support programs. This means that when individuals come to us for help with addiction, we can also ask about their gambling behaviours and assess whether they need further support in this area. Additionally, we have a co-located service enabling individuals to access both substance misuse treatment and gambling support in the same place. Another important aspect of our partnership is staff training and knowledge sharing. Our teams work closely with Breakeven to ensure that our staff members are equipped to recognise the signs of gambling harm and to have informed conversations with service users about their gambling behaviours. In turn, Breakeven staff members have benefited from learning more about substance misuse and the broader challenges that our service users face. This cross-training has helped to create a more integrated and collaborative approach, ensuring that individuals receive the best possible support. While our partnership with Breakeven has been particularly successful in Southend, we are actively looking to expand our work into other areas. We are currently exploring opportunities to extend our collaboration into locations such as Thurrock, East Kent and Medway, as well as within the prison system in Suffolk. By expanding the reach of our services, we hope to ensure that even more individuals who are struggling with gambling harm receive the support they need. Our approach has been further validated by recent national guidance on gambling harm. As Ian was saying earlier, the National Institute for Health and Care Excellence, NICE, recently issued new guidance recommending the health and social care providers routinely ask service users about their gambling behaviours. This is a crucial step forward in recognising gambling harm as a serious public health issue and ensuring that individuals affected by gambling problems receive timely support. We welcome this guidance and are proud to say that we are already implementing these recommendations in partnership with Breakeven. Our teams are working together to screen individuals for gambling harm, provide early interventions and refer people for specialist support where needed. By embedding gambling harm awareness into our services, we are ensuring that individuals facing this issue are not overlooked, but instead receive the comprehensive support they need to rebuild their lives. Throughout the day, you will hear more about the work we are doing in partnership with Breakeven, as well as the impact that this approach is having on the lives of the people we support. By continuing to work together, we hope to break down barriers to support, address gambling harm as part of a wider approach to recovery, and help individuals achieve lasting positive change. Thank you very much.